Gentlemen, let's talk about something crucial, something that affects millions of men worldwide: prostate cancer. It can be a silent predator, but the good news is, early detection can make all the difference. Regular checkups and understanding the symptoms, that's powerful information. If you only watch one video today, make sure you watch this one, all the way till the end. It might just save your life or the life of someone you love. Hit that like button down below. Let's get 1,000 likes on this one. Share the video with your friends and leave your thoughts in the comments. Subscribe to the channel so you don't miss out on the next important update. Prostate cancer. 2 words no one ever wants to hear. Yet it's one of the most common cancers affecting men worldwide. But what exactly is it? How does it develop? And what are the risks, symptoms, and treatment options? The good news? When caught early, it's highly treatable. But here's the problem. Most men don't even realize they have it until it's too late. So today we're breaking it all down in simple. What is prostate cancer? What are the warning signs? Who is at risk? And what can you do to protect yourself? This might just be the most important video you watch today, so stick around. To understand prostate cancer, we first need to talk about the prostate itself. The prostate is a small, walnut-sized gland located just below the bladder and in front of the rectum. Despite its small size, it plays a crucial role in male reproductive health. It produces a fluid that nourishes and protects sperm, allowing for fertility. Now, prostate cancer occurs when cells in the prostate start growing uncontrollably. Like other types of cancer, these cells don't function the way they should. Instead of dying off like normal cells, they multiply rapidly, forming a tumor. The big concern? Prostate cancer often grows silently. In its early stages, you may not feel any symptoms at all, making regular checkups critical for early detection. You might be surprised to learn that prostate cancer is the second most common cancer in men worldwide, right behind skin cancer. According to the U.S. Centers for Disease Control and Prevention, CDC, 1 in 8 men will develop prostate cancer in their lifetime. Over 34,000 men in the U.S. die from it every year. But here's an interesting fact. Many men diagnosed with prostate cancer don't actually die from it. In fact, the majority live full lives with the condition, especially if it's caught early and managed properly. However, for some, prostate cancer can be aggressive and deadly. That's why understanding the risk factors, symptoms, and treatment options is so important. Not all prostate cancers are the same. The most common type is called adenocarcinoma, which develops in the cells that produce prostate fluid. But in rare cases, prostate cancer can take other forms, including small cell carcinomas, a rare but aggressive type; transitional cell carcinomas, often starts in the bladder and spreads to the prostate; neuroendocrine tumors, another rare type that originates from hormone-producing cells; sarcomas, develops in the soft tissues of the prostate. For most men, prostate cancer will be adenocarcinoma, but knowing the type is essential for determining the best treatment. One of the biggest dangers of prostate cancer is that it often develops silently, without any noticeable symptoms in its early stages. That means many men may be living with prostate cancer for years without realizing it. But as the disease progresses, the cancerous growth in the prostate can start to affect nearby organs and tissues, leading to a range of warning signs. The tricky part? Many of these symptoms can be mistaken for other, less serious conditions, which is why early screening and medical checkups are so important. Let's break down the key warning signs you should be aware of. Frequent urination, especially at night, nocturia. Have you noticed yourself waking up multiple times during the night just to pee? That could be a sign of an enlarged prostate, which is a common symptom in both prostate cancer and benign prostatic hyperplasia, BPH, a non-cancerous condition where the prostate grows larger with age. Why does this happen? As the prostate enlarges, whether due to cancer or another condition, it can press against the urethra, the tube that carries urine from the bladder out of the body. This pressure makes it difficult for the bladder to fully empty, causing frequent urges to urinate, especially at night. Weak urine flow or difficulty. Starting and stopping urination. Another common symptom is trouble urinating or noticing that your urine stream is weaker than usual. Some men experience a slow or weak stream, even when they feel the need to urinate urgently. A start-stop flow, where the urine doesn't come out in one steady stream. Dribbling at the end of urination, making it feel like they can never fully empty their bladder. Again, this occurs because the growing tumor in the prostate blocks the normal flow of urine through the urethra, causing these urinary difficulties, burning or pain during urination. Painful urination or dysuria is another potential warning sign. This may feel like a burning sensation when urinating, a sharp pain in the lower abdomen or urethra, discomfort that persists even after finishing urination. This symptom is more commonly linked to prostate infections or urinary tract infections, but in some cases, it can be a sign of prostate cancer, especially if it's accompanied by other symptoms. Erectile dysfunction or difficulty, maintaining an erection. While many men experience erectile dysfunction, ED, as they age, a sudden onset of ED without any prior issues can sometimes be linked to prostate cancer. How does prostate cancer cause ED? The prostate gland is closely connected to the nerves and blood vessels that control erections. When a tumor begins to grow in or around the prostate, it can interfere with normal blood flow to the penis, damage nerves responsible for erections, lead to lower testosterone levels, making it harder to achieve or maintain an erection. Keep in mind that prostate cancer treatments, such as surgery or radiation therapy, can also contribute to ED. That's why men experiencing unexplained sexual dysfunction should consult their doctor to rule out any underlying health issues. Blood in urine or semen, hematuria and hematospermia. Seeing blood in your urine or semen is always a cause for concern. While it may not necessarily mean cancer, it's a serious symptom that should never be ignored. This occurs because the cancerous tumor in the prostate can cause bleeding in nearby tissues and blood vessels. Some men notice bright red blood or pinkish discoloration in urine, dark or rusty-colored semen after ejaculation. While this symptom could be linked to infections or kidney stones, persistent or recurring blood in urine semen should be checked out by a doctor immediately. Pain in the lower back, hips, or chest, signs of advanced prostate cancer. If prostate cancer spreads beyond the prostate, a condition known as metastatic prostate cancer, it often moves to the bones first. This can cause deep, persistent pain in the lower back hips or pelvis, upper thighs, chest, if the cancer has spread to the ribs or spine. Bone pain due to cancer is usually dull and aching, and it doesn't go away with rest. It can become severe over time, limiting mobility and making everyday activities painful. This is one of the most serious symptoms of prostate cancer, as it indicates that the disease has progressed to an advanced stage. Experiencing one or more of these symptoms doesn't necessarily mean you have prostate cancer. Many of these signs overlap with benign conditions like benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. Prostatitis, inflammation of the prostate, often caused by bacterial infections. Urinary tract infections, UTIs, more common in older men and can mimic prostate cancer symptoms. However, if you notice any persistent or worsening symptoms, don't wait. Get checked by a doctor. Early detection is the key to successful treatment. Prostate cancer has a high survival rate when caught early, so regular screening is one of the best ways to protect your health. When should you see a doctor? If you're over 50 or over 40 with a family history of prostate cancer, schedule a routine screening with your doctor. If you have any of the above symptoms for more than a few weeks, even if they seem mild, if you notice blood in your urine or semen, this requires immediate medical attention. The bottom line, prostate cancer may not always show symptoms right away, but when it does, it's crucial to recognize the signs and act fast. Your health is in your hands, so don't ignore the warning signals your body is giving you. So, what causes prostate cancer and who is most likely to get it? While doctors still don't fully understand why prostate cancer develops, there are several key risk factors. Age. The older you get, the higher your risk. Men over 50 should be especially vigilant. Race and ethnicity. Black men and men of African descent are at higher risk and tend to develop more aggressive forms of prostate cancer. Family history. If your father, brother, or grandfather had prostate cancer, your risk doubles. Genetics. Certain inherited gene mutations such as BRCA1 and BRCA2 increase the likelihood of developing aggressive prostate cancer. Lifestyle factors, obesity, smoking, and poor diet may contribute to higher risk, though studies are still ongoing. Early detection is key to beating prostate cancer. That's why doctors recommend regular screenings, especially for high-risk individuals. Two main screening tests. PSA blood test. Measures levels of prostate-specific antigen, PSA, in the blood. High PSA levels may indicate cancer but can also be elevated due to other conditions like BPH. Digital rectal exam, DRE. A doctor manually checks the prostate for lumps or abnormalities by inserting a gloved finger into the rectum. If either test raises concerns, your doctor may recommend additional testing, MRI or ultrasound for detailed imaging. Biopsy, where a small sample of prostate tissue is taken and examined under a microscope. If you're diagnosed with prostate cancer, the next step is determining the best treatment plan. For slow-growing cancers, active surveillance. If the cancer isn't aggressive, doctors may choose to monitor it with regular checkups instead of immediate treatment. Watchful waiting. A less intensive approach, typically for older men where cancer isn't expected to cause problems in their lifetime. For more aggressive cancers, surgery, radical prostatectomy, complete removal of the prostate. Radiation therapy uses high-energy rays to kill cancer cells. External beam radiation therapy, EBRT, targets cancer with precise X-ray beams. Brachytherapy, radioactive seeds are implanted directly into the prostate. Hormone therapy lowers testosterone, which fuels prostate cancer growth. Chemotherapy and immunotherapy, used for more advanced or aggressive cancers that have spread beyond the prostate. Each treatment has pros and cons, and the right choice depends on factors like age, cancer stage, and overall health. There's no guaranteed way to prevent prostate cancer, but you can reduce your risk by eating a healthy diet rich in fruits, vegetables, and lean proteins, maintaining a healthy weight and exercising regularly, limiting red meat and processed foods, avoiding smoking and excessive alcohol consumption, getting regular checkups, especially if you're over 50 or at higher risk. Early detection saves lives. If you or someone you love is at risk, don't wait, get screened. So there you have it, gentlemen. We've covered some of the early signs of prostate cancer that you simply can't afford to ignore. Remember, early detection is key when it comes to fighting this disease. Don't be afraid to talk to your doctor about your prostate health, and make regular checkups a priority. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Let's spread awareness about prostate cancer, and empower men to take control of their health through early detection. And don't forget to subscribe to the channel for more informative videos on men's health and wellness. Now I'd love to hear from you. What steps are you taking to prioritize your prostate health? Share your thoughts and experiences in the comments below. Let's start a conversation and support each other on this journey to optimal health and well-being. Regular checkups and early detection can make all the difference.